Ms. Schiavo works on healthcare organizing and policy for the National Nurses United. With 190,000 members, NNU is the largest organization of registered nurses in the United States. Ms. Schiavo also staffs Campaign for Healthy California, which represents 4 million Californians and over 60 unions and community organizations committed to replacing private health insurance with improved Medicare for all. Thank you.
Thank you. Good afternoon. Nurses are here today to address the important issue of finishing the job of healthcare reform and urge you to adopt Medicare for All into your platform as stated in the 2009 AFL-CIO Convention Resolution, and to join nurses in this fight for healthcare justice. Chairman Cummings, you spoke of crying when the ACA was passed, and were moved that you feel so strongly about healthcare as a human right. Unfortunately for nurses, the tears continue to flow daily, as Roseanne DeMoro spoke of earlier. It's real. It's real. Nurses cry daily because they go home after seeing patients who cannot afford their care. They can't afford their medication. They can't afford the high copays. They can't afford treatment for their children to keep them alive. And this is the reality of our healthcare system, even though it's a hard pill to swallow. The ACA has had great gains, ending pre-existing conditions, putting lifetime caps, allowing children to stay on their parents' insurance longer. No one can dispute that those are very important and have greatly impacted people's lives around the country. But we do need to finish the job of healthcare reform because we're not there yet. Nearly 30 million Americans remain uninsured. Just over that are underinsured. They have insurance, but they can't afford their copays, they can't afford deductibles, they can't afford the high premiums. That means that they're not going to the doctor when they need to. They're delaying care so they come in sicker. Nurses are seeing people who have insurance and preventable issues, but they come in sicker and harder to heal because they're afraid to go to the doctor because they can't afford it. It's no wonder that the majority of U.S. bankruptcies are from medical expenses. The majority of those were actually people who have insurance. People are going bankrupt who have insurance. It's such a cruel system. It's a cruel system. Currently, inequality is hardwired into our healthcare system. We continue to see wide disparities based on gender, race, where you live, what you can afford. In Richmond, we see a healthcare desert because a hospital shut down. And now you have to travel on a busy highway, as Representative Lee knows, to be able to get to an ER when minutes mean life or death. In Baltimore, for example, there are infant death rates that are equal to the West Bank and Honduras. Luckily, nurses have the cure: improve Medicare for all. It provides a single standard of care, freedom to choose a doctor, while saving over $1 trillion over the next 10 years. Plus, it isn't based on the size of your wallet. You wouldn't go bankrupt because of a diagnosis like cancer. Nothing can refute that Medicare for all would save lives, save money, and cover everyone with a single standard of care. Every study shows that. Every study shows that. Nurses believe that you can't put a price tag on human life, but I do want to share one number. As I said, $1 trillion. $1 trillion would be saved over the next 10 years with Medicare for All. We've been thinking about Medicare for All in the wrong way. It could be invested in free tuition for college. It could be invested in fighting climate change, in creating jobs, in more infrastructure projects. If we want to prevent healthcare from crippling our economy, we must pass Medicare for All. It's in fact a stimulus for our economy and not the opposite. This isn't theoretical. You should include in your platform current bills that can move this forward, like H.R. 676, Senate Bill 1782, H.R. 3241, H.R. 1464. California has a Drug Price Relief Act that's up in November. It's a perfect opportunity for the Democratic Party to push back on Big Pharma, the fastest growing cost in healthcare right now. You can also oppose the TPP, which includes monopoly pricing protections for Big Pharma that are a death sentence for patients. These should be in the platform and move forward with unanimous Democratic support. Nurses are not alone. 56% of all Americans support Medicare for all, as you've heard today. 81% of Democrats support a Medicare for all system. How can this not be in the Democratic platform? How can it not? Your base is with you. Beyond that, it's election season, and we care about independents a whole lot. 60% of independents support Medicare for all. 60. And you heard earlier, 46% of Republicans even support Medicare for all. The American public is with you on this fight. As your mother said, Chairman Cummings, and you have all the good quotes, sorry, sometimes you have to wait for people to catch up when you do the right thing. This is certainly the right thing. The party needs to seize this as an opportunity to make bold change. Otherwise, people are dying and going bankrupt while they wait for the Democratic Party leadership to catch up. Our primary shows that if the Democratic Party thinks big, Americans will overwhelmingly be with us. Incremental change like transparency bills or the public option end up being the same difficult fight against Republicans. We saw this already. If you're going to put the public option in there, it's the same fight as single payer. It's the same heavy lift as single payer. So we need to be bold. We need to make sure that this is going to be the right fight, the one that makes a real difference for all Americans. Join the nurses. Help lead this fight for Medicare for all. It will truly save lives, save trillions of dollars, and with the majority of Americans supporting it, it might actually save this election. Thank you.
Thank you. Thank you.